Those of us who've been treating mysterious diagnoses for quite some time before the pandemic know that an infection can create acute symptoms but leave the person with multiple medical issues for years to come. So finally, the chronic fatigue syndrome community is getting some respect in the medical world.
We have patients come in after 2 years of suffering from long COVID. Well, nobody checked them for Lyme disease. So we do a Lyme panel, and lo and behold, not only is the Lyme panel positive, but it seems to have been reactivated.
Your neurotransmitters need proper glucose. Serotonin transport of tryptophan require that you not be insulin resistant. GABA metabolism is literally in the mitochondria of the neurons and requires glycolysis. So if your blood sugar is not stable, you're not going to make GABA, you're going to be anxious, and a lot of people with long COVID have anxiety. It could be a blood sugar issue.
All of the processes in the body have internal clocks. So the message comes from the light through the eyes, through the melanopsin receptors to something called the suprachiasmatic nucleus. And then that sends the message, it's daytime or nighttime, to the whole rest of the body.
People who are very healthy pre-COVID, in fact, children, perimenopausal women in particular, are about 31% more likely to get long COVID. Children are about 20% likely to get COVID from each COVID infection, long COVID. So what we've learned is so much more now about kind of how this virus behaves, and yet there are still many, many outstanding questions.
A lot of practitioners are not looking for signs of long COVID in their patients. And what I'm seeing is there are a subset of kids who they will have these sort of behavioral or sometimes even cognitive or personality changes.
Pumping our lymph twice a day is just the beginning. Now, if I'm dealing with chronic illness, where is the inflammation? It's in the tissues. It's in the spaces between the cells. And as we move the body to open up the fluid, to get the glands to be stimulated, we allow the body to heal.
Once you find a practitioner to help you work with, or a bunch of practitioners to help you work with these things, it's about feedback to them to say, we need to slow down, or I think we can do more. Because you need to be empowered when you're sick. And that's the first thing you often feel you've lost is your own agency and, power.